welcome to the Veterinary Marketing Podcast, where it's all about helping your veterinary practice attract, engage, and retain clients. Broadcasting a new podcast every Monday from sunny Southern California, here's your host, Brandon Bashirs.
Hey there, everybody. Welcome to episode number 107 of the Veterinary Marketing Podcast. Thank you so much for taking the time to listen today. Today, we have a special guest on the podcast, Dr. Brett Beckman. And Dr. Brett Beckman is a dental specialist. And we talk about all kinds of really cool things as far as how to brand yourself as a specialty practice, how the standard of care works, and what kind of opportunities there are in marketing as it relates to dentistry. And we also jump into a bunch of stuff because Dr. Brett Beckman is an amazing marketer and has a really, really good digital presence online. So we talk about a lot of stuff that's very, very beneficial for everybody listening. And so be sure to listen to the whole podcast episode because it's definitely going to have a bunch of value for you. So first, before we begin, a few things. If you haven't done so already, be sure to subscribe on iTunes. And if you could do me a huge favor, please leave me an honest review. I would really, really appreciate it. Also, if you haven't done so already too, be sure to check out the newsletter. You can go to veterinarymarketingpodcast.com, sign up for the newsletter there by clicking the Get Started button. You'll also receive my 35 veterinary marketing blog post ideas. And if you just would rather text, you can text the word veterinary to 44222. And when you do that, you'll get the newsletter sent to you as well. So I'd also like to mention this episode is being sponsored by snoutschool.com. Do you ever feel like you're wasting time with your veterinary hospital's social media efforts? Well, veterinary practice manager Danielle Lampert has put together a list of 5 awesome social media tools that every hospital needs to succeed. Danielle is dedicated to teaching veterinary hospitals to use social media via her website, snoutschool.com. So go to snoutschool.com/Brandon to get her list of 5 must-have social media tools now. You'll learn how to create professional-looking social media graphics, you'll save time by scheduling posts, and you'll find out where your clients are spending time online. Not only that, she's got great tips for getting your whole veterinary team to understand the importance of social media. So head on over to snoutschool.com/Brandon to get the 5 must-have social media tools for your practice today. That's snoutschool.com/BRANDON. All right, so let's get into today's episode. As I mentioned, we have Dr. Brett Beckman. And if you've not heard of Dr. Brett Beckman, he has a website called veterinaryDentistry.net. And Dr. Brett Beckman is a veterinary dental specialist and sees patients. He's got practices in Atlanta, Georgia, Orlando, and all over Florida is where he sees patients. He is a well-renowned international speaker and operates the Veterinary Dental Education Center in Orlando, which is a state-of-the-art training facility and is one of the only in the country dedicated to teaching advancing the educational needs of veterinarians and vet techs around the world in the field of dentistry and oral surgery. So today we talk about all kinds of things, and I learned a bunch from this podcast episode just because I don't know very much about veterinary dentistry at all. So we talk about standard of care, what it is, how to incorporate it into your practice, Pareto Principles as it relates to high-end services that you can offer your practice, educating your clients, how to talk about pricing, how to talk about setting yourself up as somebody who's an expert and a thought leader in your area. And then also how to practically apply different marketing principles in your practice. So it's a great episode. I really, really enjoyed it. Thank you so much, Dr. Brett Beckman, for joining us. And so without further ado, here's my interview with Dr. Brett Beckman. So, all right. Thank you so much, Dr. Brett Beckman, for joining us today. Dr. Brett Beckman is the founder of veterinaryDentistry.net. And so, Dr. Brett Beckman, can you please introduce yourself? Thank you so much for being on the podcast today.
Oh, thanks, Brandon. Thanks for having me. I'm Brett Beckman. I'm a board-certified veterinary dentist, and I practice in Atlanta part-time, just north of the city in Sandy Springs, Georgia, and I'm also in Orlando, Florida. And I have a wonderful full-time veterinary dental technician that helps me, Annie Mills, who I pretty much can't function without. So great to have a team, which we'll talk about a little later, the veterinarian and technician team in the dentistry service.
Very cool. And can you tell us a little bit about what veterinaryDentistry.net is? Because as an outsider from the industry, I'm not a veterinarian or anything. I pretty much thought that most veterinarians did dental work, but that sounds like it's not the case, at least to the same extent that you teach it. So what is veterinarydentistry.net?
Sure, Brandon. Veterinarydentistry.net is a website that we started years ago, and it's evolved quite a bit over time, and now it's actually the basis for our 42 hours of online courses that we have available that can be read. You can register for those, and you have access 24/7 to those, and also is kind of a calendar of sorts for our live courses. We do 14 to 16 cities on Sundays around the country and in Canada each year, and then I have 2 courses in the spring, 2 courses in the fall where we actually do extractions for a weekend. One's for canine and one's for feline.
Very
and
cool.
all those are on the website. And so that website now provides that basically the outlet for the calendar and the portal for registration for those.
Very cool. So what do most practices do today as far as dentistry goes?
Dentistry, for the most part, hasn't changed a lot for the majority of practices, unfortunately, over time. Even though the technology's gotten a lot greater and more specific for being able to affordably provide what we'll call the standard of care in veterinary medicine, and I'll describe in a minute, the general practitioners are still, unfortunately, cleaning teeth and then extracting mobile teeth that are grossly mobile, and unfortunately not doing much in between. And the reason being is because the technology to provide that in between is full mouth dental radiographs, and there's still a large number of practices around the country, around the world, that don't have that, and that's the basis for the standard of care that I'm referring to. So you have that level of practice that hasn't really stepped up to the opportunities that are available to them, and it's unfortunate because the patient is ultimately the one that suffers. And the progression to the standard of care practice is taking whatever little that we've learned in veterinary school, and unfortunately that's still a big issue as well. Veterinary dentistry is not even part of the curriculum for the majority of veterinary schools in this country and around the world. So you take that aspect, and you have a practitioner who may have had a little bit of exposure and put them into the real world and put them in a practice that's practicing the clean and jerk, as we call it, to reference the bodybuilding or the weightlifting term, where they clean teeth and they pull the ones that are mobile and everything else gets left by the wayside, to the standard of care practice where you have a veterinarian and a technician dentistry team within that service, or maybe 2 technicians, or maybe 2 dentistry technicians and an anesthesia technician, and that group, whether it's 2 or 3 or 4 people, provide full mouth dental radiographs on all patients, and the veterinarian can quickly and efficiently assess those radiographs, make treatment decisions immediately, and then proceed on with the therapy. And obviously when we're looking at that model of clean and jerk, if you will, and then we're looking at the model of standard of care, the time difference in procedure is tremendous. Once we get to the standard of care, there's no such thing as a 30-minute prophylaxis or 30-minute cleaning. Our procedures now become 90 minutes, 2 hours, maybe 2.5 hours, so that step between induction and actually doing the treatment from the veterinary side, doing mainly what it involves is doing surgical extractions when you get down to it, has to be minimized in order for that extraction procedure, periodontal procedure, to be able to be facilitated in a time period that's consistent with keeping the patient safe. And we're dealing with small patients for the most part. We're dealing with cats, which have a lot of tooth resorption and periodontal disease starting fairly young for the most part. And we're also dealing with small dogs is the other big category of patients that have periodontal disease. So that is the patient that's on the table in the general practice, the dog or the cat that has periodontal disease and or tooth resorption.
Gotcha. And so how does somebody incorporate that into practice? And what are the steps to do that?
There's a lot of ways that you can do it. You can do it from the traditional sense, and that is by books, go to conferences, get your training piecemeal. And that's very difficult. It's very time-consuming. There's a lot of decisions that have to be made on the part of the practitioner as to where to get those resources and how to proceed through the resources that they have. And as we've evolved, we're now in veterinary dentistry, we've gone from that to having the availability of courses that are taught online that provide the knowledge portion of the acquisition that needs to happen prior to the practical portion, which is basically extraction wet labs that finalize that whole training process. So the recommendation that we have and that we have available now is for the learning to come about through online courses that actually show cases. You take the practitioner through, okay, this is what the patient looked like, here's the image, and then here's the x-ray associated with that image, what do you do? And walk them through that learning process to the point where they see it like they would see the case actually in their practice. And so that multiple facet learning process, that being able to see it, hear it, and experience it is much better than reading a book and trying to piecemeal lectures that they've seen over several years in order to get that to culminate into a good experience that they can actually put into practice. The other great thing about having for instance, our courses that we have, that's kind of a one-stop shop. You've got everything there. You've got all the learning through the videos and the lectures format that can be revisited time after time again, and then you've also got the access to our wet labs that we provide, and we're not the only ones that do that. There are multiple teaching centers around the country. There's Dr. Luskin out in Baltimore and Dr. Woodward in Colorado, Dr. Nemec in California. We're in Orlando, so there are multiple places where you can get that type of training. So depending on your geographic area, you might choose one of those as well. But for the general practitioner, there's nothing that's quicker, there's nothing that's more streamlined than to be able to have a group of courses that you can go back to and you can review and you can watch and learn from a case standpoint.
Very cool. That makes a lot of sense. One of my favorite books is called You Can't Learn How to Ride a Bike at a Seminar. And it talks specifically about that, and actually all of those things that you talk about really, I'm sure, help to cement and teach everything that they need to know. Can you talk a little bit about the Pareto Principle? When we're talking about high-end services, I use the Pareto Principle all the time in marketing, so I'm interested to see what you use it in respect to the high-end services that practices can offer in practice.
Excellent. Well, I've heard you mention that before in your podcast, and it's something that we've taught for quite some time, and it goes back to the old veterinary economics magazines, and you couldn't literally open up one of those and not see something about the Pareto Principle or the 80-20 principle, where 80% of the revenue from the practice is derived from 20% of the clients, and that 20% of the clients are the ones that are also can be classified and have been classified as your A clients. They're the ones that if you tell them to meet you at midnight on New Year's Eve for a dental procedure for their pet, they're going to be there, and they'll be there early. So that is your best client base in the practice, and we have to step back and look at that, not only just in conjunction with dentistry, but in conjunction with how we approach practice in general. And this is kind of getting into the general practice theory a little bit, but we can't please everyone. So would we rather please the 80% that are responsible for 20% of the income and probably 80% of the frustration and the client problems, or would we rather up our game and cater to the 20% that is responsible for 80% of the revenue and really increase our services to those clients to match their expectations? And as we travel through this era of technology, and it's just exponential now of what we can do, we find that clients are more knowledgeable, they are demanding more, and we see it in specialty practice, and unfortunately to the detriment of the general practitioner, where a cleaning may have been done several months prior and there's still an odor, and the client goes back to the general practice, and for one reason or another, multiple reasons, we get them on referral, and we, unlike the general practice, take full mouth radiographs, and we find all this pathology under the gum, and we end up doing 6, 8, 15 extractions where this patient had a cleaning and was sent home good to go several months prior. So it's kind of a difficult situation that we deal with, and we try to avert problems when we see that, but it's becoming more common, and we see it quite a bit as a dentistry specialist, and it's going to be a problem, unfortunately, for the general practitioner going forward, where they're going to have to deal with clients that are not happy because they didn't provide that level of service. So it's kind of a wake-up call for us, and dentistry is one of the things that we can do in general practice that really cements the bond with the client, because every single one of those patients that comes in that's a small breed dog that's 6, 8 years of age and has the oral odor and the calculus and the gingivitis and the gum recession, every single one of those dogs need full mouth dental radiography, and every single one of them will have anywhere from a couple to 15, 20 or more extractions. And if it's done correctly, if we go in and we do surgical exposure of that tissue, we not only remove the teeth, but we also clean all that tissue up, we contour the bone, make sure that there's no disease left, and then suture back the gingiva, then when that patient comes back for a recheck, that owner is so appreciative, because they can detect any one of a number of positive behavioral changes that have happened since the patient is recovered versus prior to the procedure. So those clients become even more enamored to your practice, because they've seen the benefits of what one procedure can do for their pet. And this is not the exception either, Brandon. This is the rule in general practice. If a practice is practicing at that level, they're practicing at a level close to what we do as specialists from a periodontal standpoint. You know, they can learn how to do extractions just like we do extractions, and there are many, many practices around the country and around the world that are at that level, that provide the full mouth dental radiographs and provide the surgical extractions and have that same experience with every client that comes back for the recheck. And so they know. And the ones that are in your audience, I'm sure there's some there, they're probably shaking their heads yes now, because they realize that, yeah, that's what happens every time.
Definitely. Well, that makes a lot of sense. I mean, people don't go to the dentist and the only choices are clean it or extract it, and, you know, without any other checkup. So as far as client education, I think that's really where the marketing comes in, and teaching clients that it's just so many opportunities for practice, especially if you specialize in this. What do you see practices who are specializing in this, what kind of opportunities are there with client education and kind of converting clients to this way of thinking?
Well, interesting that you asked that, because I was doing some search just for to check out our own rankings in search for different things. the other day, and I came across a practice. I won't name the practice, but it had advanced veterinarian specialty in it, but it wasn't a specialty practice. It was just a general practice that had a level of care that they could provide that's similar to what we're talking about. And they had multiple 5-star ratings on Yelp and on Google, and their perception within the area, I'm sure, is these folks really know what they're doing with dentistry, and they definitely are getting referrals from that internet exposure and search exposure, but they're also probably getting referrals from some of the practitioners around the area, whether or not it's driven from their clients or not, because if there's no one else in the area that's providing that service and the clients are asking for it, then that practice is going to be the go-to practice even for the generalists to send to a generalist to get those things done. And we see that in our Veterinary Dentistry Academy group. We've got a group of 150 plus practices that are at that standard of care that have been through our courses, that have been through our wet labs, that experience that very same thing. They work to build the quality of their practice, and then they use social media, they use search, they use their web pages that are specific for dentistry and optimize those for search, and so they get a lot of traffic coming into their website that shows the general clientele of the whole region how good their level of practice is and how good that standard of care is. And so the client ends up going to their vet and saying, hey, do you guys have dental radiography? Well, no. Well, I know of a practice that does, and it's this one. Can I go to them to have the procedure done? And that's fairly common among our group. So I know it happens. I see it multiple times, and so that's kind of the way things are going. If you can kind of shrug that old clean and jerk and embrace the new technology, embrace the new training, and get the practice to that level, you can certainly utilize that to your advantage. And again, you go back to that 80-20, the Pareto Principle that you were talking about, and that's a perfect example of drawing that 20%, that kind of client that you really want into your practice.
Definitely. Well, there's your unique selling proposition. You can be first, you can be better, or different, and it sounds like you get all three of those, which is an ideal situation because most practices aren't doing that. So that's very exciting, and I'm sure it helps you to become a thought leader in your local area for sure, which is very, very important too. Anytime you can become the person who's the go-to as far as content creator, I mean, and there's so much you could do just in video alone for your practice. It would be really, really beneficial for sure. But have you seen kind of people that are working on this become like the thought leader? Like, we have Dr. Sue, the cancer vet, but, for your super local area, you could be, Dr. Brett, the vet surgeon dentist guy. You know what I mean?
Absolutely. Absolutely, Brandon. And I think that should be the goal of the practices that embrace dentistry at that level.
Definitely. Well, just before we're going to switch gears just a little bit and talk about some other marketing stuff, but before we switch gears, you mentioned something about a library of client education images that you'd prepared for listeners of the podcast.
Oh, sure. Well, part of the success of the practices that are practicing at that level of care is being able to relay that to the client and give them a quality education. And over the years, I've always kind of had a hobby of photography, whether it be nature or landscapes or certainly dentistry over the years. And I put together a while back a library that consists of the common conditions that we see in veterinary dentistry and made those available to people for purchase. And so for your listeners today, we are going to give those to you as well as a variety of resources that are on our free membership website. So if the listeners would be interested in that, they can go to veterinarydentistry.net and that's not .net versus .com, veterinarydentistry.net//Brandon, Brandon. And you'll get immediate access to that image library. And then the following day, I will send you a video that shows me actually in a client mode as if I were talking to the clients on how to use the 4 most valuable slides in that image library, which consist of slides that educate the client about the reason that they're there in general practice, and that's periodontal disease.
Very cool. Thank you so much for that. And there's a few other questions that I wanted to ask. One thing that I follow you on Facebook, and I also get your emails as well, and I'm really, really impressed with the quality of marketing that you and your companies do. And you also own several practices, and that's in Atlanta, I think. Is that correct?
Yes.
And so
Atlanta and Orlando.
Oh, that's right. And so I wanted to ask you, because I assume that you have people doing social media, you have people doing, specifically marketing for you. One thing that I see practices struggling a lot with is analysis paralysis, so to speak. They'll get the idea that they want to have somebody perform a service for their practice, but they're not sure how to evaluate that person and then take the steps to get that implemented in their practice. So I was wondering, do you have any tips for practices as they market themselves when they're looking for some kind of a vendor? What's your general rule of thumb, so to speak, for finding and attracting talent to work for you? I know that's kind of a really big question, but I'm really impressed with pretty much every marketing aspect that you do.
Well, that's a great question, and part of the answer goes back a couple years to listening to a variety of podcasts like yours that have such a wide variety of marketing information and all these actionable things that you can actually not just listen to, but you can write down and make a list of steps to do to get to the point where you're just knocking off little chunks at a time, and that's kind of what you have to do. And I know you've talked about that before in some of your shows that you've done. But I had listened to several podcasts over the years, and one of them pointed to me to a Facebook expert who was the only one at the time, I believe, who was teaching a course in Facebook marketing, and that's Rick Mulready. And he has a podcast now called The Art of Paid Traffic, and he had a course called The Facebook Advantage. And I took that course. I knew nothing about marketing, and this was about 2 years ago, I guess. And I was completely blown away by all of the things that you could do with Facebook and how you could do retargeting and all the things that you talk about on a frequent basis. And so I started to do that myself. And I did a couple ads, and it was just, the course was fantastic, but I had to sit back and think, should I be doing this? And the answer was no. You really need to do what you're best at. If you're a veterinarian, you want to do the things that a veterinarian does. You don't want to have to do things like marketing and things that you can delegate to other people. And so I asked Rick if he had a recommendation for someone who would be able to provide that for me. And he went back to the person, asked if he could refer me to that person, and he did. And my friend Michelle has been providing that for me from that point, which has been about a year and a half ago. So I have a Facebook marketing expert who took Rick's course, but is also that's her business, is to market, help other businesses market through Facebook. And then at the same time, there's a lot of other things that need to be done, especially when you've got a website that you're changing up a lot. And if you're in general practice and you have a website, you should be changing pages, adding content on a continual basis to increase your search exposure and let Google see what you're doing, because the more you add, the more quality content that you add, the more exposure you're going to get. So the next thing that I needed, and the thing that I would recommend that many of you as listeners look at from the potential of building your website and building your web pages so that they give you better exposure, and that is to hire someone to do your web development, even if it's on just a kind of a low-level basis. I have a full-time web developer from the Philippines who is absolutely fantastic. His name's Jiro, and we were on together 5 minutes before this. We started this interview working out some things for to complete the website for this image library for you guys. And he's very inexpensive. He works for me full-time, and that's available to general practices. The way that I found out about that was from a book by the name of Virtual Staff. Well, actually, the company's name is Virtual Staff Finder, and I can't recall the name of the book, but Chris Ducker is the founder of that group, and you can give them your qualifications for a general virtual assistant, and they will give you in detail 3 people to interview. You choose from those 3 people. If you don't like those 3 people, you have another 3 that they'll find for you. I've never had that experience, but they will do that as well for $350 to $450, and it's absolutely changed the way that we've been able to get out our content and to free up my time to do things that I need to be doing, not doing that kind of thing. So Virtual Staff Finder is an excellent group, and the Filipino people are just fantastic as far as their work ethic, and most of them are very fluent in English, so it's a great mix, and we really enjoy working with our web developer. So that's certainly something to consider.
That's some great info. Yeah, I've used virtual assistants through Odesk, which is, I'm sure, not as good of a vetting process because it's more time intensive. So that virtual assistant is very cool. I'll definitely link that in the podcast notes for sure. That's a really cool.
One other thing I'll add to that too, Brandon, the first virtual assistant that I had, his main duties were to post on social media. And lo and behold, not long after we started with him, Meet Edgar came online as a platform where you actually can put in your social posts in a queue from a library that you create, which takes no time at all. You can put old blog posts in there, you can put articles, you can put anything literally that you have posted online and schedule it to go out, and schedule it and forget it. You don't ever have to do it again. And we've had that up and online for going on 2 years now, and we've got probably 500 pieces of content in there, and we post twice a day, and once that 500 pieces of content have been posted, then it starts over again. So it's really a great resource. So we literally replaced his job and gave him a different job just by using that platform, which is about $49 a month. Now there are a lot of other platforms that are like that out that do more than that, and I can't remember the names of the last couple that I've looked at, but there are platforms out there that are like that are available that also help you produce the content. You can edit in them, and you've probably even mentioned them in some of your podcasts. You probably have them on the tip of your tongue now.
Yep, there's a few like Hootsuite and other ones too. But Edgar, actually, I kind of like Edgar the best out of all of those automated options, just because you get to fill the library once and it can spit it out automatically, and that's a really cool tool for sure. So if you have a content library built up, I think that's fantastic. And mixing in some native advertising for sure, but just like you said, it's important. I mean, you're a highly trained specialist in veterinary dentistry. To be having you do web development or anything like that is absolutely a waste of your skill set for sure. And so making best use of all of the skills that you have is the number one importance for sure. So definitely some really good insight there. For sure. Well, thank you so much, Brett. I really appreciate you coming on the podcast today. And just so that everybody can be clear, where's the best place for people to find you at? And don't forget, again, it's veterinarydentistry.net/Brandon. I'll mention it and link it in the show as well. But where's some good places to find you as well? Is that the best spot to start, would you think?
Actually, that's great. That's where our courses are and all of our information. We also do Facebook Live every Sunday at 8:30 a.m. Eastern, and that's mostly every Sunday. It can't be every Sunday, obviously, but most of the time. So Veterinary Dentistry Live on Facebook. So if you're in Facebook and you put Veterinary Dentistry Live in search, that'll come up. There's plenty of resources there. You can message me there, or if you want to email me directly with any questions and chat a little bit, I'm at veterinarydentistry@gmail.com.
Very good. Well, thank you so much, Brett, and I really, really appreciate your time today.
Thank you, Brandon. Keep up the great work. You do a fantastic job with the podcast.
All right, so I hope that you enjoyed today's episode. It was definitely interesting for me. I hope that you thought it was interesting as well. Be sure to go to veterinarydentistry.net/Brandon to check out that library that Dr. Brett Beckman has set up for you. If you ever have any questions, comments, need help with anything, please don't hesitate to reach out, and I hope that you have an amazing week, and I'll see you on next week's episode.